Government of Vihiga in partnership with Capricorn, championing evidence-based advocacy, SIBA, and Jumuiya Hospital. And some of the things we'll be discussing today are not just on HPV vaccination, because we've seen that the previous vaccination schedule used to have 2 doses for this particular vaccine, and now it's on 1 dose. And the first time it was brought in, there was a bit of a challenge in getting people to accept it. And we'll be speaking to experts today to get to understand what has been the experience in administering this vaccine, and why is it important for us to raise awareness on HPV, why is it important for us to have our young ones vaccinated against HPV, how it is transmitted, and what we can do to, raise awareness and bring more information on this, as opposed to raising negative information on it. So today we're joined by Jacinta Mudezi, Mercy Omido, and Clara Chitwa, who will be telling us more about HPV and discussing more as the lead up to the awareness on Monday. So I will welcome you again to this program and ask that for your questions, please send them in the comments. Tutazijibu as usual. And karibuni to our guests. Karibuni tena. It's a pleasure to have you with us today. So as is the norm in this particular episode for us, we usually start with knowing our guests. So we'd like to know, you can tell us your name, and we'll start with Jacinta and then Mercy and Clara. And so Jacinta Mudezi is the youth representative at the Vihiga Youth Service Board. So we'd like to know your youth representative, what's this? Ni kazi gani unafanya? What does Jacinta do? And what's your experience on that?
Hello, my name is Mudezi Jacinta, aka JC Kenya, the Rumba Girl, and I'm sitting at the Committee of Vihiga County Youth Service Board as a linkage between the young people at the community, representing them here at the county government. Of course, majorly we just disseminate information to the young people from the county government. I'm also the founder of Mudezi and the Community, whereby I advocate for sexual reproductive health and right, and HPV being amongst them. It is also part of the roles that I play as a Mudezi and the Community founder. So thank you so much.
Okay, and next we'll be having Mercy Omido. So Mercy is a health promotion officer. So again, to you, Mercy, you can tell us what is health promotion, what do you do, and what does your role entail, especially since you're in charge of Vihiga sub-county?
Okay, my role in health promotion is generally to create demand for the services, which one of them is the vaccination services, and also to sell the benefits of the services that are being given at our facilities, creating awareness to the community and ensuring there is behavior change, as well as demystifying the myths and misconceptions that affect the uptake of vaccination services.
Thank you, Mercy. And finally, we have Clara Chitwa, who is the EPI coordinator for Vihiga sub-county. So I think I'll hand over to you to tell us what is EPI and what does your role entail.
Thank you, Shamim. I'm Clara Chitwa, the Sub-County Public Health Nurse Vihiga, and I coordinate nursing services within the sub-county, and I also coordinate immunization services in the sub-county. I love doing this job because when I talk about immunization is one of our key pillars in primary health care, where we are preventing diseases. Therefore, remember, prevention is better than cure. And it makes me happy to see that by immunizing the people of Vihiga, we have protected them from diseases. Thank you.
Okay, thank you for that. And I'll just start with you, Clara, because today we're talking about HPV. And before we start going deep into the details of it, we'd like to know what is HPV, how is it transmitted, and, we say HPV, what is HPV in full, and you can tell us a bit more about that.
Thank you. HPV in full means that human papilloma virus. This is a virus that causes cancer of the cervix in women. This virus is normally transmitted sexually. And the key carriers to this virus are the males. So the male carries the virus in their foreskin, and will tend to deposit the virus in each and every woman that they'll have sex with. I would say the high risk factors that contribute to HPV transmission, for those who start sexual intercourse at an early age, are at risk of getting human papilloma virus. Those also who have multiple sexual partners have also a risk of getting human papilloma virus. And at times you could be having one partner, but your partner could be having several other partners. So that one puts you also as a of getting HPV. Thank you.
Thank you, Clara. And you've mentioned, one of the things you've mentioned is cervical cancer. But one of the questions we often see residents ask is, when we talk about HPV, we tend to only focus on cervical cancer. Is it the only cancer caused by HPV, or does HPV cause other things beyond cervical cancer?
Thank you for your question. HPV, that is human papilloma virus, is the causative organism for cervical cancer. And we are seeing in our studies that cervical cancer is the second highest and even killer cancer in women. And yes, it may cause other cancers like penile cancer or warts. But when we go back to studies and reports that we have received, we may see that those are very small figures. Very few people may be suffering from that. So the majority are suffering from cancer of the cervix, and that's why we really negotiate and we are really advocating for a HPV vaccine, that is human papilloma vaccine, to come in place so that we can protect the women. Remember, once you lose a woman, before you lose that woman, you have already spent a lot. And there are mothers, there are children there who are going to lose a mother. There is a husband there who is going to lose a wife. And they will be left without anything at home just because of that cancer. That's why we really advocate that women should no longer be suffering from. We have started with the young girls. Thank you.
Thank you. And now that we've talked about what HPV is, and we've mentioned some of the cancers are caused, with cervical cancer being one of the key ones, I'd like to move to Marthy. Before we discuss, how this vaccine, I'd like to know that this is the second time this two-dose vaccination for HPV. So what was the experience? Because a lot of the things we tend to see on social media was that people were speaking against HPV vaccine, and they were saying that it is not good. So what was the experience for that in Vihiga County, and particularly in Vihiga sub-county where you work in? What was the response among the residents for this particular vaccine during the last time when it was a two-dose vaccination?
Thank you so much, Shamim. As my colleague Clara has said, that HPV vaccination was introduced in 2019, and that is when we started vaccinating girls. At that particular time, we were vaccinating girls between the age of 10 and 14 years. That particular time, the and the acceptance in the community was still not very. The reception in the community was very low. But with time, we increased awareness, and that improved. Girls transferring from one school to another. reaching all our girls, the ones who got the first dose. But as we continue now, that the approach of how we are going to encouraging the parents of the girls 10 years old to bring their children to the facility. And that was now is still more effective and cost effective, just as the previous time that it was doing in 2 countries. Apart from maybe the girls
And thank you for that, Mercy. And as we wait to have our sound sorted, so we're seeing that so in as much as there was a bit of hesitancy at the beginning of the vaccination, there was still some progress in getting a lot of young girls vaccinated. And I think one of the key things that we saw at that particular time was some of the things that affect the way we
the vaccination is because they lack the right information. Number one, to the parents, this is to the parents, they should know that cervical cancer is the second killer right now. That one should scare them a lot. Knowing that now, secondly, the HPV vaccination is being given by the government to our girls at no cost at all. And the other approach is that our girls can actually access this vaccination wherever they are, because this vaccine has been distributed in all our public health facilities within Vihiga County, and particularly within Vihiga sub-county. And so the reason why a parent should never hesitate to bring her girl who is 10 years old for the vaccination is that vaccination has saved lives. It has prevented diseases before. Vaccination is also the cause, one of the intervention that has led to eradication of some of the diseases in the world, like the smallpox disease. And so vaccination is safe and most appropriate in controlling most of these communicable and non-communicable diseases.
And I'd like to move to Jacinta. Just guess out here. So when during our time when we were younger, we didn't have this HPV vaccine at 10 years old, at 10 to 14 years old. We were not exposed to this. So what has been, what is the conversation amongst our youth, and what has been, because we see a lot of us who are on social media, us young people, and we tend to, spread information based on what we see. So what has been your experience and what are people saying about this HPV vaccine? What are our youth saying?
Thank you so much. Like I can say up to date, we still have information about HPV, which is really alarming because we really need to disseminate this information to the grassroots level. During my time, of course, I used not to know about HPV, what is the meaning of HPV, what is the cause, what is just HPV generally. But now that I'm like this and I'm doing advocacy at the community, and I had to like do my own research because I remember HPV ilikuja around 2019 there, right? So it was really hard, you know, it was really hard for the people to accept the fact that HPV vaccination is going to cater for the life for the future life of our girl child. It's still a problem, and I think we should use social media to really influence the uptake of this the HPV vaccination. Yes.
Okay.
Also, about the HPV, we used to know that it is causing infertility in girls, which is not supported scientifically. There's no proof. And also, we used to know that it's only girls who are supposed to be vaccinated, but the carriers are boys, and they also need to know the information of HPV. Now that right now people are having so many partners, you understand? So the carriers are men, and they really need to know the information behind this HPV. So we're not supposed to seclude the men, but include them in this conversation. Yeah, thank you so much.
Thank you for that. And as a follow-up to that, you've mentioned, we often talk about things and we say, this causes this and this does this. And one of the things we have in our society to talk about these things because they're seen as taboo topics. So how can we reduce the stigma around HPV and HPV-related cancers and STIs within our communities, and especially amongst the youth?
I think the one way we can reduce stigma is just to have open conversation on sexual health, whereby when youths wanapenda kusikizana. Like if parents are open to speak about sexual health with their children, it will help them to open up and speak about their sexual health. You understand? So some questions, they won't be inconvenienced to ask some questions about their sexual life. So I will just say that we should normalize these sexual health talks, whether in schools, in churches, even leaders in these pulpits. When they speak, they also need to take advantage and sensitize on the issue of sexual health, so that it becomes normal, so that youths don't hesitate to pose these questions that are really affecting them. So we just normalize the issue of sexual health. I think that is the most important thing.
Okay.
Yeah.
Thank you for that, Jacinta. And I'd like to ask Mercy, when we move to our communities, how does the department approach, especially for hesitant parents and those who are not willing to have their children vaccinated? What is the information that you have for them, and how do you approach such cases, and what has been your experience with this now that we're going to a new vaccination as well?
I think our approach has been and will always be to create awareness and to reach the community by whatever means. We are already doing community engagement, our dialogue days that we have on a regular basis through the community health service structure. And we are also doing targeted meetings in schools, especially to try to involve the teachers who are the caregivers of these children in school, and also engaging the parents whenever we have gathering in schools. We also engage them to continue selling the benefits of vaccination, especially HPV vaccination, so that we are protecting the future of our girls, knowing that cervical cancer is the second killer cancer among women in Kenya. And we are also using the mass media, the radio stations, to ensure that this information reaches every parent or guardian and also the girls themselves, because they are conscious now. They can listen, they can hear, and they can know the importance of, or they can be able to digest any information that you give them, apart from being guided by their parents. And so as healthcare workers, the ones who are giving the services, they are also trying to see that they take the services closer to the child. Although the approach this time has changed, that the parents have to take the first initiative to bring the child to the health facility for that child to get the vaccination. Immediately the child gets to 10 years, that is the girl. And the healthcare workers are also doing targeted outreaches whenever they are hard to reach areas and those people cannot easily access the facilities. So they have dates that they hold an outreach there, and the immunization is one of the services that is being given at those outreaches, and so that we ensure that our girls are not left out.
Okay, thank you, Mercy. That is Mercy Omido, Health Promotion Officer. And now, Clara, I'm back to you. Mimi ningependa kujua, for those of us who were not there when for Jacinta and I, we've said sisi tushakuwa wakubwa. All of us were not there during the new schedules came in when most of us had grown up. So tunaweza pata vaccine ama it is only available for those who are young girls, or what up to what age can people get the vaccine, and what happens to those who are not able to benefit from this HPV vaccine?
Thank you, Shamim. Yes, it's unfortunate that some of us never got the chance to be given that vaccine. And that's why I say the vaccine is aimed at being given to it happened that maybe by the time this vaccine was located, it insists to the parents and the community to take this chance to bring their children, that is the virus now. I answer today. It may take me 20 years for me now. So that's why we want to protect this generation. In 20 years to come, we should have minimal women suffering from cancer, the way we are suffering from cancer, because we were never given the chance. And as we are saying in 10 years, studies have shown that just one dose alone will be able to protect 70% of the cancers that HPV virus may bring. And with that, it means the government with WHO has given also the parents and the girls 10 to 14, a short period for them to come and be vaccinated. Then after that chance has been closed, it means we'll remain with only the 10-year-old. Now come to those who are already above 10 years and would wish to have this vaccine. It means you cannot get from our routine vaccination in our facilities, because whatever the government has purchased is catering for the population of the 10-year-old. Now for me and you who are past that, it means we have to get that vaccine. And how can we get this vaccine? We can only access this vaccine now in the private sector, maybe in and you will not just be given. It will mean you have to be run some tests. As we are talking, we have 90, 70, 90% that we are looking at. When I talk of 90% in the coming years, the 70 want to screen the women that never get a chance to be vaccinated. Me and you to come also to the health facilities for screening of cancer. We have for HPV, and you are given the swab, you go and you swab it yourself, then to the laboratory and the results come. In the 70% that we are testing, For those who may turn to be positive having HPV, then we are saying the last 90. We want to treat them as early as possible so that we make them live longer. For those who may turn negative, now this is the time you can have your chance to HPV vaccine. It is there at a cost. You can protect yourself. That is what we are saying.
We continue this conversation, I'd like to know, to now especially for Marcy and Clara, who are a lot of how the insurance of this works. So now for the parents who, and for, we're vaccinating, and the new schedule says that you're to be vaccinated at 10 years old. So what happens? Is it paid for? Is it free? And what are the options for those who are insured or uninsured when they want to get access to this vaccine?
For the eligible girls, at 10 years, they are given that vaccine in any public health free without paying anything. But like my colleagues.
Thank you for that. And just I'll get back to now Jacinta. I would like to know now,
to our young girls, and also it was only for our girls alone. But she has answered most of the questions, unless maybe she wants to expound other things. But I've heard that it doesn't cause infertility, right? Because scientifically it hasn't been proven yet. Yeah, so I think that was the only concern I had.
Okay.
Yeah.
Okay. Yeah, and you can add if there are any other side effects.
I can also add something. People are feared to bring their girls for vaccination because some thought that we are giving a contraceptive. We have had HPV with us for the past about 6 or 7 years because we started vaccinating in 2019.
Yeah.
And when you look at that population that we vaccinated, already I know some are mothers, meaning it has proved wrong. Secondly, it has proved us wrong that it does not cause infertility. For those who may feel that by giving vaccines we are making our girls become hotter because others then maybe in the culture of the new generation, or maybe what we look at or what we watch. That's why HPV telling us early enough, because it is now shorter. 6 months. So you before they are exposed to the human papilloma.
Okay, thank you for that. And now, Marcy, it's good you have taken the microphone. I wanted to know now, beyond, because we're having the launch on Monday, on December 8th, beyond that, what are some of the steps to raise more awareness on HPV and beyond this platform, for those who may not be information a lot of times? So what are some of the things that will be done beyond the launch?
Community engagement still continue, and that has been and will only HPV, the benefits of HPV vaccine at the community level, and the effects of cervical cancer to our girls or women. And beyond Monday activities, we are still continuing to engage them. We are going to engage them on a one-on-one with their youth meetings, and also we will continue to level. We have the school health program that we engage the youth. HPV is one of the topics that is going to rock those talks whenever. Again, mass media on radio shows, we already have sessions of HPV vaccination and the effects.
Conclude today's episode, and thank you again to Jacinta, Mercy, and Clara for to ask questions on social media, and some of us want to come to the offices and to ask this question. It's not the only vaccination that has changed. Where can people access this information? Nikikuwa na swali nitaenda wapi? Nipigie nani simu?
Asante sana. Watu wetu wa Vihiga sub-county, ukiwa na swali lolote, iko na namba ya in-charge pale. Ukiweza kupata hiyo na maswali mkaongea, utaweza kupata jibu ama ataweza kusaidia. Majibu hayo. Na ndio sababu kila mahali tulipo sisi uwache na mambo ya chanjo, na ukiwa na swali lolote kuhusu chanjo una uhuru wa kunipigia na kuuliza ama ku SMS, na namba yangu ni
07222686 remarks or any last comments ungependa kuambia watu wa Vihiga nini, sana sana especially as we now engage the parents, the educators, the guardians to have wale wasichana 10 years old to be vaccinated. And as Jacinta
right now it's almost every youth has access to social media, social media is a platform where we can get correct and incorrect information. But now, is to liaise with the influencers on TikTok, on social media, and give them this information so that they talk on these matters on HPV, because their followers believe in that. So if they have facts about HPV, eventually the followers are going to believe whatever they're going to say. And this means that information on HPV has disseminated very well. And also the creative content, the TikTokers, the artists who can do songs. For instance, me as Mudezi and the community have done a song, and maybe my followers who will be listening to the song, it is going to influence them, and they're going to get the information from the song, So let's normalize using the content creators to also help you, the Department of Health, to get this information to the society, and also to the youth champion who have been saying maybe in this TCI, the Breakthrough, IPAS, KMET. Let's also help the Department of Health to get this information to the grassroots level, because we used to sensitize on different issues or different matters, but not HPV. But right now that HPV is with us, it's going to live with us. Let's put it into our objectives, and let's spread the information. And also our parents, saizi our watoto can make a decision on their own. The 10 years old girls, they cannot just go to the facility and do it unless they have consent with the parents. So also let's incorporate these Mama wa Chama, go to the Matanga, any forum. Let's use these forums. I've seen we have Mheshimiwa is carrying some talent search out here, and I was privileged to be on one of them, and it carries a large multitude of people, whereby if we get a platform, even if it's 10 minutes, just talk about this HPV, because these girls are out here, their parents are even part of that congregation. So I just think we just normalize any congregation anywhere, we just use it to spread the issue of HPV. Otherwise, don't have much to say. Mudezi and the community is going to help with the spreading this good news about HPV, and I don't have much to say. Thank you so much for this chance.
Okay, thank you, Jacinta.
Maybe mine is to say that we are calling to action all the parents, the teachers, the leaders, and the religious groups in the community at large to be promoters and advocates for the HPV vaccination for the girls who are 10 years old, and know that future iko fiti na cervical cancer free na HPV vaccine ndio from.
Thank you, Mercy.
Asante. Kwa wenzangu wana Vihiga, ningependa kusema hivi: yeyote aliye na msichana ama dada ambaye ako miaka 10, tunakuomba fika Jumatatu pale municipal grounds ambapo tutakuwa tuna launch na tutakuwa pia na huduma ya kupeana chanjo ya HPV kwa wasichana wetu. Zaidi ya yote, tembelea kituo chochote cha afya kilicho karibu na wewe, hasa vituo vyote vya kiserikali. Chanjo hiyo inapatikana pale na ukaweze kuhakikisha mtoto wako amepata chanjo. Kumbuka, tumesema tunataka tupeane chanjo hii wakati ambapo msichana wetu hajabaleghe. Tuko na watoto wetu nyumbani na sasa wako katika likizo mrefu. Hatujui watoto wetu wanaenda kufanya vitu gani. Tafadhali kama mzazi, tafadhali kama ndugu, tafadhali kama dada, hakikisha msichana ule ako protected. Na nataka kusema hivi, chanjo hiyo ya HPV ni chanjo iliyo salama na it has been proven that it protect cancer kwa wasichana wetu na kwa wamama wetu. Tafadhali tujitokeze na tuwalete watoto wetu. Zaidi ya yote, yeyote atakayepokea ujumbe huu, tunakuomba pia nawe mpitishie mwingine ujumbe huu, maana wewe utakuwa unamsaidia mwenzako. Asante sana.
Asante, Clara. And to our audience and to our listeners, thank you for joining us today as we discussed HPV vaccination. And I hope we've been able to answer some of the questions that you've been asking. Na kwa wale hamjajibiwa, as Clara has mentioned, Jumatatu tukutane pale Mbale Municipal Grounds as we have the HPV launch, and you can have our health experts will be able to answer questions and will be able to communicate more information on this. And beyond that, if you have a question, kindly visit your nearest health facility or ask a healthcare worker who you may be able to have access to and be able to understand what this vaccine is and why it is important for us to, raise awareness on it and learn and solve some of the misconceptions and misinformation that we tend to have. And for the youth, as Jacinta has mentioned, we encourage you to continue spreading positive information on this. And again, if you have any questions, continue asking. We will bring experts to answer all the questions that you have on Feedback Friday. And as we conclude, we'd like to thank our communication crew who've been behind the scenes. We apologize for the sound and some of the challenges we've had today. And we also thank Clara for allowing to sit in the sun. Jua imetupata hapa kwenye set kidogo. So thank you again for joining us. We look forward to seeing you next week on Friday with Feedback Friday with me, Shamim Hussein. Asanteni sana. Until next.